Thank you for joining us tonight. My name is Barry Erickson, and I'm Community Engagement Coordinator at Wheaton Public Library. We are proud to bring you another session in our ACES series. ACES stands for Aging and Caregiving Engagement and Support. Through this series, we are trying to provide a single source of vital local information needed by our communities, seniors, and their loved ones. Tonight, we have two experts on benefits and support programs for veterans. Steve Fixler retired from the Army in 2004 after serving for 25 years. He currently works at the Veterans Assistance Commission of DuPage County. The Veterans Assistance Commission's primary mission is to provide temporary financial support to veterans and their families. A little bit later, we're going to hear from Kristy Bassett. She is the Community Engagement and Partnerships Coordinator on the suicide prevention team at Edward Hines Jr. VA Hospital. Kristy is a licensed clinical social worker who has been part of the VA since 2015. So with that, I will turn the screen over to you, Steve, to get us started. Thank you so much for being with us tonight.
Yeah, Barry, thank you very much for having us. All right, so my name is Steve Fixler. I work at the Veterans Assistance Commission of DuPage County, and we're located in Wheaton at the DuPage County building, the 421 building. And like she said, hold on a minute right here. The VAC, our primary mission at the Veterans Assistance Commission is to provide financial assistance to veterans and their families. This is state law, and it was created under the Soldiers and Sailors Relief Act back in 1895. It was then upgraded to what's called the Bogargas Act, and then renamed the Illinois Military Veterans Assistance Act. And that is what we're under right now. It's what's state created, the Veterans Assistance Act. So when two or more veterans organizations within a county get together, they can form a commission. All right. And then once they form the commission, they'll create a president, vice president, secretary, treasurer, and other board members. And each VAC operates independently under their respective commission. So in my commission, we're made up of the VFW, American Legion, Military Officers Association of America, the Disabled American Veterans, the Jewish War Veterans, and the Reserve Officers of America. Those are the primary ones. We really only have like 8 organizations. And we have a president, vice president, secretary, and everything like that. The commission comes up with the rules and how the office is going to operate, and I operate the office under their rules and everything like that. So I said that each VAC in each county is independent, and they operate under their own commission. So I'm only going to talk about how DuPage County operates. I'm not going to talk about Will County, Cook County, or any of the other counties. There's 102 counties in Illinois, and there's only about 46 VACs. So some counties down in South Central Illinois don't have a VAC. So DuPage County. The office again is located in the 421 building on North County Farm Road in the county building. I am the superintendent. I have an administrative assistant and a veteran service officer. Both of them also do case management, and they help out with helping with filing assistance for veterans, financial assistance for veterans, and we also do help out with VA claims, filing federal VA claims. We are VAC employees. We're not county employees. The VACs are a unit of local government. We're our own independent government, such like the Forest Preserve or the Health Department, and we're technically VAC Commission employees. Funding, where do we get our money from? Everybody wants to know that. We get our money from the county. All VACs get their money from the county. We get it through the general fund. We do not get it through a tax levy. We're not on a tax levy. We get it through the general fund. And the county provides us an office and everything that goes in an office, desks, tables, computers, and telephone, and mail, and everything like that. They also pay our salaries. And each year I submit the budget request that goes through the county board, and they accept it or they don't accept it, or we negotiate, but they've been very good. DuPage County Board has been very good for us, and we've been getting the funding that we need. Now, what do we do with the funding? How do we operate? First of all, like I said, we help veterans and their families. And you got to be eligible for financial assistance. Our eligibility is the veteran must have served at least 6 months of federal active duty. That's active duty, not National Guard time, not reserve time, unless they were put on federal active duty. The veteran's last discharge must be honorable. If it's honorable, that's fine. If it's general under honorable, we got to take a look at it. Has to be a resident of DuPage County. I don't think anybody would like if I spent DuPage County money on somebody from another county. So it must be a resident of DuPage County. The veteran must be under the financial poverty level of 250%. So we look at the poverty level of 250%. So for right now, a veteran needs to be under $2,831 a month. If he makes less than $2,831 a month, he's financially eligible. If he's married, $3,814 a month. He would have to be under that. We use the highest poverty level possible, which qualifies a lot more veterans and their family members. They also must have had to have a financial event. They can't just come to me and say, hey, I'm poor. They have to have a financial event. So if the veteran had to take his daughter to the emergency room and it costs $300, that's a financial event. Losing a job is a financial event. Getting your hours cut at work is a financial event. Your car has to be fixed. That's a financial event. So some type of financial event. We do work with widows, widowers, and children 17 and under if the veteran qualifies. So if a veteran passed away and his widow comes to us for financial assistance and the veteran meets the requirements for an honorable discharge and time in service, we will help out the widow. Even if he passed away 20 years ago, we help the widows and children under 17. So eligibility, at least 6 months of federal active duty, honorable discharge, resident of the county, must be under the 250% of the poverty level, and must have had a financial event. Now, what type of assistance do we give? This is the type of assistance. The financial assistance is we might pay a month's rent or a month's mortgage. We might pay utility bills, car payments, car repairs, work home related expenses, food, family essentials, and moving expenses. So if he's renting, we might pay a month's rent. If it's got a mortgage, we could pay the month's mortgage. Utilities, ComEd, NICOR, water bill, sewer bill, we might be paying those. Car payments, if he has a car payment, we might pay a car payment or 2 or 3. Car repairs, if he needs new tires, if he needs a new radiator, something to keep the car nice and safe. We primarily look at safety factors and everything like that, but we can pay car repairs. Work home related expenses, let's say he finds a job and he needs steel-toed boots, we'll go get him, we'll pay for his steel-toed boots. Or if he needs scrubs, he gets a job in a hospital or a clinic, health clinic, he needs scrubs, we'll pay for the scrubs for him and everything like that. Home-related expenses, a hot water heater, furnace, we may pay for a hot water heater, we may pay for a furnace. A window air conditioner we might pay for, or we just pay to have it fixed. The food, family essentials, we have Target gift cards and we have Speedway gas cards. So we can give out some Target gift cards, $25 each, and some gas cards too. Moving expenses. If a veteran's moving from one apartment to another apartment, we may pay for the transportation costs of his move and everything like that. Now, that's not all inclusive. We primarily pay bills. That's what we do. We can pay small medical bills, small dental bills. Again, we pay bills to try to compensate for the veteran's loss. So if he lost his job, we again will try to pay his rent or pay some car payments. We pay about $1,000 a month, and it's only one time a year. So about $1,000, maybe $1,200 a month, one time a year. So if his rent is $800, his NICOR is $200, and his ComEd is $100, we may pay the whole $1,100 for 1 month, and he's done for the year. He can reapply next year on his anniversary date. He can reapply. Maybe he's got some car payments. So we might pay 4 months of car payments, but it comes up to about $1,000. Like car repairs, $1,000 car repairs. So we work with the veteran, what he needs to try to compensate him for his loss. And we don't do dollar for dollar. If he had a medical bill of $300 and another medical bill of $200 and his rent is $1,000, we just paid $1,000 and he gets a little bit extra. But if his medical bill was $2,000 and his rent is $1,400 and I pay the $1,400, then maybe he does lose a little bit, but we try to help him out. So primarily what we do is a financial assistance. And as you see right there, it's not ongoing. It's not month after month. We do not provide general assistance. We send the veteran to the township for general assistance. Non-financial assistance, we help with VA claims. We can help filing a VA claim, service-connected claim, VA pension claim. We help people get enrolled in VA healthcare too. Bus passes, we do have bus passes for veterans that don't have transportation. If we're sending a veteran to Hines VA Hospital in Maywood, sometimes they want the bus pass. We'll give them 2 or 3 24-hour bus passes. They go to Hines, they go to their shelter, they go to Hines and everything like that. We do have transportation to VA hospital and clinics. So we have a transportation program to Hines Hospital in Maywood. It's a contract with PACE. We'll send a taxi cab to the veteran's house. Veteran gets in the taxi cab, drive him to Hines. He takes care of his appointment at Hines. Then the taxi cab will drive him back to his house. They call that curb-to-curb service. The veteran pays $10 one way, and we pay the remainder of it. So the veteran pays $10 cash to the taxi cab, and we pay the rest of it, which sometimes could be like $60, $70 one way easily. And we also help applying for military discharge papers. If they don't have their discharge papers, we help them get it. Another thing too I need to add that's not on the slide is we help with military burials, and we do help pay funeral expenses. Not only that, but the VA has a death benefit and a burial benefit too to help pay for funeral expenses. Even if the veteran is going to be buried at Abraham Lincoln and everything is covered, sometimes they still have to pay the funeral home and sometimes still have to pay the transportation to get there. The VA and my office can help with the funeral expenses. So financial assistance, again, financial assistance, rent, mortgage, utilities, car payments, car repairs, work home related expenses, food, family essentials, moving expenses, and other types of small bills up to around $1,000. All right, now here is an example. Veteran contacts us, we send him a VAC application form, our application form. He sends it back or he comes into the office. We do see people in the office. He brings the filled out application form and signed. He brings a copy of his military discharge papers. If needed, he brings a copy of his marriage license. And if he has children, children's birth certificates. He also brings income documents like bank statements, his work pay stubs, Social Security letter, VA disability letter. He brings proof of income. If he has no income at all, he has to tell us that. Now on our application form, we have one sheet that lists all that and how much he makes. And he's got a sign and date stating that what he's telling us is true, the amount of money he has coming in and everything like that. He brings the bills he wants us to pay. So he'll bring a copy of the lease. He'll bring a copy of his utility bills. He'll bring a copy of his car payments. If we send him to get his car repaired, we send him to one of our car repair shops. They fix his car, they send us the bill. And then we pay it and everything. Once we approve him, we process the paperwork. So let's say he comes in with everything he needs, bank statements, he's good to go. We photocopy his lease, his utility bills. We then process the paperwork and we use the county's finance system to process it. So it actually goes to finance, to the auditors, to the treasurer to cut the check, and then the county clerk mails it out. We always tell everybody you got to wait 2 to 3 weeks to get paid, but sometimes it's a little bit quicker. And it always goes to the vendor. We never give cash or a check to the veteran. Now we do have some petty cash, but otherwise all the bills go to the vendor or the agency. It goes directly to them, okay? Now I have down there marriage license, birth certificates, and other bills if appropriate, if needed. We work with the veteran via email, fax, even carrier pigeon if that's how we can get it to us, or in person in the office. So that's the quick how it works, for example, of financial assistance. A lot of times we're waiting on the veteran to get us paperwork, and we wait and wait and wait. We don't have his bills or anything like that. But when they show up and they have everything, they can be out of here in an hour and everything's done. Now, I do have to say something. We look at marriage license, households of 2, 3, 4. To be a household of 2, the veteran has to be legally married. We don't use the home rule. I forgot what you call it offhand. But they have to be legally married. And the children have to be legally the veteran. The veteran has to legally have the children and everything like that. Okay. That's it really for financial assistance. I will go to who I am and where I'm located. That's me again. That's our address, 421 North County Farm Road. That's the county website with our webpage on there. There's my email, stephen.fixler@dupageco.org. And that is our office phone number, 630-407-5655. We work Monday through Friday, 8 to 4. All holidays we're off. And Barry, I think that's about it. If there's my famous question mark on my last slide. I hope I didn't go too fast. I tried to, repeat myself and cover the bases.
Oh, that was great, Steve. Thank you so much. Yeah, and so just a quick question. You mentioned that VAC form. Where would the veteran find that? Is that online or something?
Okay, it's on our website.
Mm-hmm.
It's on our website. And usually when the veteran contacts us, we mail him a copy of it or we email him a copy of it. So they don't have to look for it. Sometimes we say, can you go to the website? And they say, yes, I can go to the website. Or we email it to them, or we mail it to them, or sometimes we'll fax it to them. A lot of veterans work out of Hines Hospital, and their social worker contacts us, and we send it right to the social worker at Hines Hospital. They fill it out right in front of them at the social worker's desk, and then she sends it back to us. So they don't have to look for it. We'll send it to them.
Great. Okay, thank you. I don't see any other questions right now. So why don't you go ahead and stop your screen share and we will turn things over to you, Kristy.
Good to go. Did I stop screen sharing?
Yeah, I think you did. I took over, I believe. Yeah.
Yep.
Okay. So I am Kristy Bassett. I'm with Edward Hines Jr. VA Hospital, which is located a hop, skip, and a jump down the road, down Roosevelt Road. So technically we're in Cook County, but pretty darn close to DuPage. So the VA's mission and values is to fulfill President Lincoln's promise to care for those who shall have borne the battle and for their widow and orphan by serving and honoring the men and women who are America's veterans. Our core values focus on our minds, on our mission of caring, and thereby guide our actions towards service to others. We're very much customer service oriented in our care for veterans. We strongly follow the iCare system, which is integrity in our services, a commitment to our veterans, advocacy. And my role as a social worker, I am very familiar with advocating for the veterans that I've worked with, respect, ensuring that no matter who walks through our doors, that we're treating with the respect they deserve, and excellence in care. So a lot of folks think when they hear VA that we do everything under the sun, but there's actually 3 branches. So Hines is part of the Veterans Health Administration. Then benefits, things like getting service connected, if you've ever heard of a VA home loan, those are things that fall under the Veterans Benefits Administration. And then there's also the National Cemetery Administration. The National Cemetery Administration honors veterans with final resting places and national shrines and with lasting tributes that commemorate their service to our nation. There's over 3.1 million grave sites in 136 national cemeteries. So I think the closest one to all of us would be the Abraham Lincoln National Cemetery in Elwood, which I believe is in Will County. And then there's 33 soldiers' lots and monument sites. There's burial benefits as well that are available to veterans, like such as getting a headstone or a marker, a burial flag, or a presidential memorial certificate. So Veterans Benefits Administration, I'd say this is, we get a lot of questions about this. I've gotten this question in my role now in suicide prevention. I previously worked in our Healthcare for Homeless Veterans program. Folks are really interested in this. So some of the benefits that veterans can get include a veteran's compensation. So it's called a service-connected pension for any kind of injury, whether that's mental health or a physical injury that was sustained or exacerbated by their time in service. A veteran's pension, which is the non-service connected pension. So this is for folks who may not have sustained any kind of injury, but who served during an eligible period of wartime and have income below, I think, the poverty line. There's survivor benefits. There's vocational rehabilitation and employment assistance. So at Hines, we have a compensated work therapy program. If anybody's heard of like the GI Bill or the post 9/11 bill, that can afford folks with education benefits. There's education assistance, home loan guarantees, so like that VA home loan, like I mentioned, and then life insurance. So Veterans Healthcare Administration, locally, we're considered part of a region called VISN 12, which is the VA Great Lakes Healthcare System. So there's over 50 sites of care that serves veterans throughout Illinois, Indiana, Wisconsin, Minnesota, and Michigan. This map might be hard to see, but it kind of details out what falls within this region. So your nearest VA healthcare facility is Hines VA Hospital. We're actually our own city. We have our own post office, our own zip code, everything. But I always tell people we're located like off 290 First Avenue. If you know where Loyola Hospital is in Maywood, we are basically neighbors with them. So if you ever needed to call, I put our main phone number up there, is 708-202-8387. That will get you over to central scheduling. And from there, you'll be able to ask questions such as like, when could I come in to set up an appointment with eligibility? I also put the phone number for our mental health clinic, which is 708-202-2002. If folks don't want to come to the large VA hospital, there's several services that are located in our community-based outpatient clinics. So we have several. We have one in Aurora, like North Aurora, Hoffman Estates, one in Joliet. We've got one out in Kankakee County in Bourbonnais, LaSalle VA Clinic in Peru, and then the Oak Lawn VA Clinic. For vets who would prefer not to get their care within a VA hospital system, they can choose to use a vet center to get therapy service. So there's the Aurora Vet Center, Forest Park Vet Center, Orland Park Vet Center, Chicago Heights, Evanston, and Chicago. This is kind of a unique area in that, yes, Hines is the closest VA clinic to you, but we have vets that, live out in DuPage County that may choose to go to Jesse Brown VA Hospital, which is in Chicago, or even up to Lovell Hospital, which is in North Chicago, as you head up towards Wisconsin. And we have vets that, maybe they love their provider for cardiology at Lovell, but they really like their psychiatrist at Hines, and they love their primary care doctor at Jesse Brown. It's totally kosher to go to the different VA facilities for different reasons. So eligibility is a really big piece, and it can be really confusing. So I always say, when in doubt, just call our eligibility department, and that number will be on the next slide. But kind of like the quick and dirty of it is, if someone entered the military before September 7th, 1980, and received an honorable or general under honorable condition discharge, they would be eligible for healthcare. if they entered the military after September 7th, 1980, they must have served 24 consecutive months of active duty. If they were discharged due to disability, injury, or hardship, they're exempt from that 24-month rule. And again, they have to have received an honorable or general under honorable conditions discharge. If you served in the reserves or National Guard and you were called to active duty by a presidential executive order and you have a DD 214 showing this completed assignment, then you would also be eligible. So who's not eligible? If you received an other than honorable discharge, bad conduct, or dishonorable discharge, we always encourage vets to contact a veteran service officer to explore the possibility of upgrading their discharge, which could potentially make them eligible for healthcare benefits. VSOs can be located through DAV, your local American Legion, or county or state representatives. If someone served in the reserves or the National Guard and they were not called to active duty by a presidential executive order, they would not be eligible. There's a lot of confusion that sometimes folks who are in the reserves or National Guard, their discharge papers will show active duty training only. And that active duty training only does not make them eligible for VA. If you served active duty for training, just like I said, for training purposes only, that would not make you eligible. Continuing, so if a vet who was previously ineligible for care due to maybe they didn't serve long enough, or maybe they had an other than honorable discharge, but let's say they get service connected at a rating of 10% or more. So that service connected being potentially maybe they have tinnitus because of loud noises from serving overseas. Maybe they have PTSD. Those would be things that would then make them eligible for VA care. If the veteran was rated at 0% service connected, so maybe that's like eczema, then they're only going to be related for the care as related to their eczema diagnosis, right? So someone who gets eligibility because of PTSD is going to be eligible for any VA service because it's a rating of 10% or more. I don't actually know if eczema is 0%. I could be wrong in that, but we'll just say it for the purpose of this presentation. But if somebody got eligible for that 0% eczema service connected rating, then they'd only be eligible for dermatology and potentially primary care. Veterans who were previously ineligible for care who report military sexual trauma are now eligible for any VA care that's related to military sexual trauma. And that's really up to the discretion of the provider. So for instance, when I worked in our homeless program, we would frequently work with vets who maybe weren't eligible because they didn't serve long enough or because of their discharge, but who did report military sexual trauma. And as a result of that MST, as we shorten it to, we could connect that their housing instability and that their homelessness was directly related to their experience of military sexual trauma in the military. Veterans who have a discharge of other than honorable can receive up to 90 days of mental health care through the VA. They don't have to be at imminent risk of suicidal ideation or homicidal ideation to utilize those benefits. That's something that recently changed. So if you potentially know of a veteran who may be 3-4 years ago, it's I can't go to the VA, I have an other than honorable discharge. They can go now for at least 90 days of mental health care through the VA. Vets who were discharged from the military within the past 12 months can receive mental health treatment even if they don't meet any other requirements. And a big piece is that income-based eligibility, there are income-based eligibilities if someone's not service connected. So, for instance, if, you served 10 years, got out honorable discharge, but you're not service connected, right? You didn't really have any, you don't have any injuries from your time in service. If you're making $100,000, $200,000 a year, you're not going to be eligible for healthcare benefits. So that's something that is sometimes confusing for folks, but I just want to make sure I highlight that. Always, when in doubt, just contact your local VA's eligibility department. I accidentally left Milwaukee because that's where I last did a presentation, but for Hines, the number is 202-8387 extension 28838. They will help you out and, suss out whether or not someone is eligible. I always push folks to, like, if maybe they have a discharge of other than honorable, or they think at all that they might be able to get service connected, try to do that and work with like a VSO to do that process, because it could make you eligible for care. And that care is something that veterans are entitled to. Vet centers, which I had mentioned a few slides back, they're community-based counseling centers that provide a wide range of social and psychological services, including professional readjustment counseling to eligible veterans, active duty service members, including National Guard and Reserve components. So like right now, if you know a guardsman or a reservist who is in need of mental health care, they can go to a vet center. Some of the services that you can get at a vet center include individual and group counseling for vet service members and their families, family counseling for military-related issues, bereavement counseling for families who experience an active duty death, military sexual trauma counseling and referral, outreach and education, and screening and referral for substance abuse, medical, employment, and VA benefits. So vet center eligibility is different from Veteran Healthcare Administration eligibility. So to be eligible to go to a vet center, they have to have served on active duty in any combat theater or area of hostility, right? So we're not even thinking, there's not discharge, doesn't really isn't taken into account in terms of eligibility, right? You could have an other than honorable, dishonorable discharge, but as long as you served on active duty in a combat theater or area of hostility, you would be eligible for the vet center. If someone experienced a military sexual trauma, a few slides back, I talked about how if someone reports military sexual trauma, they'd be eligible for VA care. Some folks would prefer to go to a vet center. It's a much more smaller, intimate clinic versus like the huge hospital. That can be very triggering for people who have experienced military sexual trauma. It can be a lot nicer to just go to a much smaller clinic where you're not encountering a lot of people. So great option for that. The vet center's eligibility is for those who provided mortuary services or direct emergent medical care to treat the casualties of war while serving on active military duty. For those that performed as a member of an unmanned aerial vehicle crew that provided direct support to operations in a combat theater or area of hostility. Those who accessed care at a vet center prior to January 2nd, 2013 as a Vietnam era veteran. Those who served on active military duty in response to a national emergency or major disaster declared by the president, or under orders of the governor or chief executive of the state in response to a disaster or civil disorder in that state, or anyone who's a current or former member of the Coast Guard who participated in a drug interdiction operation, regardless of the location. So as you can probably see, eligibility is like, I feel like eligibility could be a presentation that's all day long for the VA. So like I said, when in doubt, call your local vet center, call your local VA facility to determine eligibility for care. Hines VA is the third largest VA healthcare system in the nation. So there's a plethora of services that are offered. And a lot of times I think that folks just don't realize like the full scope of practice and care that someone could get within the VA. It's a heavy door to get into the VA, but once you're in, we do a pretty good job of connecting veterans to all the different services that they need. So some of those services include primary care, mental health care, preventative care, specialty care, care management, inpatient and outpatient pharmacy, our women's health care, geriatrics and palliative care, and long-term services and support. Things like anesthesiology, audiology, bariatric surgery. We have chaplain, dermatology, nephrology, a whole host of things, infectious disease. Throughout the COVID pandemic, we've had units for COVID patients, and we've opened our doors as needed to take overflow from civilian hospitals. So like from Loyola or McNeil or anywhere else that just had run out of beds, we would then take civilians as overflow. We offer polytrauma care, spinal cord injury, let me see if it's not right. It's not on the next slide, but we have a blind center. People come from all over the country to go to our blind center. Really amazing service that's offered. And then we have a lot of specialty services that folks aren't aware of. I mentioned before, but I was in our housing and homeless services program. So we were able to provide emergency housing, transitional housing, and if you've ever heard of like Section 8 vouchers, special Section 8 vouchers for veterans and their families. There's employment services. So we have work therapy programs, employment specialists that are working with our vets to get them reintegrated and back into whatever career path they're interested in. I'm from our suicide prevention program. That's pretty unique to the VA. Not many hospitals have a team of people that are dedicated to suicide prevention. We have a women's health clinic. And most VAs do. And that's usually, it's nice. It's separate care that's available to women. Military to VA transition and care management program. So those are our folks that are working with vets who have been newly discharged and trying to get them engaged in care. We offer intimate partner violence program, our veteran justice outreach program, which works with veterans that are involved in the justice system. They're not lawyers, they're social workers. So, they can't necessarily get people out of trouble in the legal way, but they work with the courts to get our veterans, make sure that our veterans' needs are met and that there's an understanding that there's a lot of different traumas that they're experiencing in the service that they can carry on home and that can impact their everyday life. We have our own police department. And with COVID, we've been able to offer telehealth like most providers have. It's really been great because Hines has such a large catchment area. Now, you guys are, in DuPage County, not too far, but we serve veterans that are out in like Ogle, Lee, Bureau County, really far. It can be really difficult to say, yeah, I'm going to drive 3 hours for a 45-minute doctor appointment. No, thanks. To be able to do that via telehealth, I think has really been able to expand our reach and those that can access our services. Okay, so questions, comments, concerns. I put my contact information up there on my email, KristyBassett@va.gov. My phone number is 708-202-2805. If I don't know the answer, if you have questions after today or anything like that, if I don't know the answer, I'll get you in touch with who can get that to you.
Great, thank you so much, Kristy. And just, if someone is watching the recording, just to confirm that phone number that was on that previous slide, the phone number was correct. It just said Milwaukee, but the 708 prefix was correct. That's great.
Yes.
Thank you. And just a reminder to our attendees that Q&A is open. If you have any questions, to go ahead and enter them there. While we're waiting for people to maybe think over the presentations and come up with some questions that they may have brewing. Kristy, is it just a veteran that would contact your organization, or could perhaps a caregiver or a spouse contact you?
Yeah, absolutely. Caregiver, spouse, vets can contact. Now, things like wanting to get their medical records information. Obviously, we follow HIPAA. But yeah, anybody can contact.
Great. Thank you. It was a wonderful overview of all the different things that are available, much more than certainly I knew. So that's great. It was good to hear all that. I don't see any other questions. I don't know if you all, as presenters, are thinking, whenever I present, somebody always asks me this. Maybe we could address that. But
I tried to cover the questions as part of my slides. But the question you asked Kristy is one I get too. So sometimes it's the daughter of the veteran that contacts me, and that she's going to help her father, the veteran, get financial assistance. And then she does all the paperwork and collects everything based for him, for us to help out. Or that's the wife of the veteran that comes to us because her husband just isn't able to come to us or something. And she collects the paperwork from her husband and gets all the documents and everything like that. So it's family members that come to us also, not just the veteran himself.
Great. Okay, thank you. Yeah, because again, we want this series to be helpful for not only those who are dealing with certain issues and events, but also for their caregivers, because that also can be someone who's really helping them out. Okay. Well, I don't see any other questions, but we are going to be sending out some links with additional information and contact information, of course. So, you know, if you're watching the recording of this program, you can pause at those screens and get that information. But also, if you would like to contact me and get that contact information, just email me at ce@wheatonlibrary.org. That's CE for community engagement @wheatonlibrary.org, and I would be happy to send those contact links out to you. But thank you so much to you, Kristy and Steve, and your respective organizations for just thank you for taking the time and effort to put these presentations together for us. Lots of great, really important information, and we're delighted to be able to provide this through the library. Again, we're trying to create that kind of one-stop shop, one place to get all this wonderful information that our seniors and caregivers need. So thank you so much for doing that. With that, I think we will say good night. Take care, everybody. Stay healthy, and we hope to see you again soon. Good night.